everyone, and we're here on another an episode of TRC's Member Spotlight, and we're just really excited this week we can introduce to you another valued member of the TRC and someone who has actually been working with us on our theory of change. Today we have Dr. Kevin Handoko with us, and we're just so grateful that he has made the time to do this. Thanks so much, Kevin. Just giving a really short description of Kevin's profile, and I'll let him introduce himself professionally. Kevin is a medical doctor who has who has experience working in rural Indonesia on the front lines, and we're just so excited that we have his insight onto what it's like to be working in the front lines in that setting. But going forward, he's moved into the the healthcare sort of health systems, just that space, and he has done his MSc in global health management from the Imperial College of London, which is how we have been introduced to him and his work, and that's where he has partnered with TRC as well. Um, some of the areas where Kevin has been contributing in and has been studying also when he as a researcher is some areas of health diplomacy, digital health transformation, and just trying to build a resilient health system going forward. And we're so glad that we're able to partner with people who share our heart on these matters. And thanks so much, Kevin, for doing this and for taking the time to be with us today. So something that I read about you in your I think it was your LinkedIn profile. And it was just the first line, it just caught my attention, and I would love to hear more of your experience and what that was like, and how your journey has been. I'll just let me just read it in your words. I think there it is. After working as a community general practitioner, I saw how systemic gaps cost lives, especially in crisis. And that insight led me into global health management, where I now combine clinical experience with health economics, policy, financing, business strategy, behavioral science, human-centered design, and innovation to help build smarter and more resilient health systems. And that so resonates with TRC's heart and what we want to do going forward. So I mean, do take the time to elaborate on what that was like and what that experience was like for you. But just to start off, why don't you tell us a little bit more about yourself? Kevin, Kevin, if Kevin was my next door neighbor rather than Kevin the doctor and global health management professional. But go ahead, give us something
So
about
much
yourself.
for thank you, Nikita, for the kind introductions. And hi everyone from the TRC network and who's listening to this as well. Yeah, I'm I worked in a rural setting just before I entered the global health management. It has been a amazing and actually rewarding experience about implementations of health that I've worked with, especially about the public health sector. And I really treasure that moments. The amount of the things that I learned there, it's just very different if you're looking at the system level.
Yeah,
But f my reflections on working in especially in rural health or working in a rural community, actually makes me think that there are things that needs or could be done in a system level to basically
mhm,
bridge those gaps, because I personally see how um, things such as lack of access of quality medicines or medicines in general um, is a problem.
yeah,
And where in the global health, I got a amazing opportunity, a very humbling opportunity to be one of the first Indonesian delegate as a global health consultant with the Indonesian Minister of Health and Foreign Affairs, to see
yeah,
how global health diplomacy works and how those things work. Where in the global health setting or the national or international policies, we talk already so advanced things such as how can we rule out HPV vaccines or how can we roll out more vaccines or more cutting edge technology to detect stuff. Whereas
Mhm.
in a rural settings, which is a very local, very nuclear setting, we see that things such as amoxicillin, like
Yeah.
basic
Yeah.
essential medicine are still lacking. And this is
Mhm.
something that we need to think. I think in the past, we see that um, people are dying from simple infections. But now the questions shifted from how can we treat that from how can we make those access equitable. I think the conversation changed. So that's where
Yeah.
I said I see how those things cost life, and that actually drive me and makes me passionate on how to drive
Mhm.
system level change, basically.
Right. Yeah. Yeah. Thank you for sharing. And that's amazing because we're talking about gaps that are huge. It's not it's not a simple shift in a system either. And that is something that we wanted to hear more from you on now. There are advancements on just amazing levels happening in some parts of the globe, whereas in some parts of the globe there's just basic lacks. And I remember one of our other TRC members sharing with us about how there's a midwife in a rural setting in Uganda who needs to care for 200 mothers or 200 antenatal cases, as well as people mothers women in ready for delivery. And that's just, it's amazing to see the kind of disparity there is. um so yeah, but that is something we are passionate to learning more on. There are digital advancements, there's so much going on, but how can that sort of be implemented at scale in some of these settings that are just so disadvantaged at the end of the day and under resourced. And so are there any breakthroughs that you are seeing? Is there progress in that? Or what has your experience or observation been?
One of the things that I reflected and see, I also read something alongside of this is about the shortfall of healthcare workers, right? Not just rural settings, but globally. And now people are leaving the professions because
Right.
the professions is seen as something that is unsustainable with the
Mhm.
and it's very demanding job. Like I have like when I was in rural doctors, I have to work hundreds of hours, like almost
Yeah.
probably 150 to 200 hours a month in order
Mhm.
um to do everything that we should do for that people,
Yeah. Yeah.
which to be honest, like I'm really happy to do so, but like it's not something that is sustainable,
Correct.
especially
Exactly.
if you already have a family or you have. We also talk about when we were doing consulting as well with the Church Incident TRC, about how the financial systems is not giving enough for those people. I
Yeah.
think it gives a bit of insights to um, a pain like pain points and challenges that happens, especially in healthcare workers in general, or people working in health as a main professions.
Yeah.
um,
Yeah.
in term of pain points, I think it's about stigma as well surrounding that, like, oh,
Correct.
if you think that you're
Yeah.
working as a healthcare worker, you know everything, and mental health is being on the sideline, for
Yeah.
example, and and lack
Correct.
of also understanding or capacity. We talk about digital health transformations, right? I think sometimes those things are being rolled out without um, considering what is happening in the local level. So we approach policy in much more top-down approach instead of
Mhm.
building a bottom up, which is something that like doing the global health consulting with the TRC and the Church Institute is something that me and my team was really keen,
Mhm.
really excited to work, because we are trying to create a theory of change and diagnosing the problems and creating a pathways behaviorally
Mhm.
and organizationally to change something from the bottom up, from the community that we have, from the network that the TRC have. And I think the breakthrough that we need to think about, especially, is about how simple things that we can do, that we
Mm,
identified as part of the work that we did, was actually things like making community and building our
mhm.
capacities,
Yeah, yeah,
that are the ones that are actually easily implemented and will have the higher impact, right?
correct.
And I think the breakthroughs will start from that and see that as a commitment,
Yeah,
because oftentimes rural community health workers or health workers in rural settings, we're literally being flooded by day-to-day tasks, and we don't
yeah,
we don't see that as something important because there's something more important outside usually.
correct. Yeah. Yeah, yeah, we completely agree with you. And you're right, like while we think about how do we bridge these gaps in access and how do we how do we make sure that some of these digital advancements are working for all populations everywhere and disadvantaged, but we, like you say, we could look into what we already have and how we can sort of leverage that to build resilience into the system now. And as you say, the shortage is just growing every day, and there's an attrition that just cannot be arrested right now. And while there is some sort of pullback, we're looking at a massive global shortage in a few years from now. So yes, the leveraging what we have is it's just so crucial to pay attention to what is already there and how we can use that. So but do elaborate for us on what that experience was like to just sort of delve into that whole thing with the theory of change and to see what these different aspects were and what how we could actually bring about behavioral change, right? And where yes, there's awareness and there's advocacy and policy issues that we're constantly trying to sort of haggle for, but then um, what can be done just starting from individual levels, like starting bottom up, like you're saying, from the individual levels,
Mm.
and what sustainable behavioral change can be implemented going up. And so tell us what it was like to try and build that with your team from the Imperial College. Yeah.
Yeah, we work like our team, like we work with a psychiatrist from Ghana,
Mhm.
neuroscientist from in India and Nigeria, and also a pharmacist from India. So we are a
Yeah.
disciplinary, and we see things that, health as a health professionals in multi different disciplines, and we see things differently, and that's actually
Right.
enriching the discussions. And also I think we successfully develop a robust theory of change, but right now
Yeah.
it's the questions like how can we implement that, right? How can those change not goes beyond the theory? How can
Mhm.
we
Correct.
actually observe that change and feel that, to improve healthcare worker resiliency in general? I think the questions now shift to that part. Um,
Mhm.
I think from we did a lot of like different frameworks and approach, like identifying behavioral drivers and behavioral challenges and also opportunities to build that theory of change. But we see that from that theory of change, for example, there are micro individual level and micro team level, and
Mhm.
also meso system level, and also macro policy level. So,
Yeah.
or there's a lot of like um, different degree of
Yeah.
things we need to do simultaneously at once. But of course,
Exactly.
the start needs to come from the micro level, individual
Yeah.
and team level. We need to build trust between each other. We need
Mhm.
to be able to basically understand things like what is actually mental health for healthcare workers? Why is it important? By giving those people access to resources, but also capacity above that, such as giving them psychological first first mental health trainings, for example, first aid training. And I
Yeah.
think those small things will build up. And then at the same time, we will build things like system level chains,
Right. Yeah.
and advocating for things in a system level as well. But we need to, it's important to build that journey from the micro level. And I think it needs to go more than just preaching or creating those chains, right? We need to start those conversations just daily. And I
Yeah.
think starting those things from the day-to-day conversations and actually admitting that we need it
Yeah.
change
Yeah.
things.
Yeah, yeah, completely agree with you on that. So, as someone who's been in the front lines yourself, do you want to share with us one what that experience sort of was like? And you've already explained about just the unreasonable hours of work and just the lack of financial compensation that just sort of makes all of it so much harder, especially when you have a family to support and so on and so forth. But also, if you could dream, what would be one positive change that you hope to bring, or not to bring, but would happen in your, if whether or not we have the control over it, but what do you think would truly make a difference to healthcare worker, just to build them, to support them? What one thing do you think would truly, it could be big or small or whatever comes to your mind, but share with us what, from your experience, what do you think needs to be put into practice?
I think it's just like owning things and then
Mhm.
be creative on how we are finding solutions
Yeah,
that work for you, work for us in our community. And I think that's the start of those changes we'll actually do, and focus on the things that we can actually change now
right.
and be clear about it. And that's why, though, like part of theory of change and part of the proposed activities, for example, for to create healthcare worker resiliency, we did develop things like easy win packages that could
Hmm.
also be different in different health system setting. We
Yeah,
need to also understand that even though there is a national health settings or systems, we see sometimes in the local settings or rural settings, it works a bit differently, just maybe a bit
yeah,
different. So I think
yeah.
like mixing and matching those things that works for us and for our community and for our healthcare workers and for our populations that we serve, I do believe it will make change. So I think as a frontline health workers, I think we discussed those things about the frugal health innovations that we can do um,
Mhm.
in rural settings, but also how can we implement those things and basically learn from each other. For example,
Yeah.
we learn from different case studies from other countries or from
Mhm.
other health systems. And I think it needs to go both ways as well. I think we oftentimes think that the learning needs to come from if we come from a low middle income country, let's say we see that, oh, we must learn from a high income country. But I think
Mhm.
learning comes vice versa.
True. Yeah,
And
yeah.
I think we need to support each other in that sense. Because I
Yeah,
think the low middle income countries, we will develop a frugal innovation that will actually cut costs for high income countries.
exactly.
And
Yeah.
I think if we're coming from a low and middle income countries, we see that there are things that is actually easy and not stigmatized that we
Right.
can
Yeah.
actually use for our
Mhm.
setting. So I think that's the mix and matching those stuff will actually works and it will click, I think,
Yeah.
in that sense.
Yeah, yeah, that's amazing. Start small, start now, be creative. That's great. It's a brilliant way forward, I think, and I completely agree with you on that learning does not have to be one way, and it can be two-way. And I think a dream for us at the TRC community is to just create a space where we're able to have those conversations, right? And we can share with each other. There are some things that are so inherently built into some cultures where it just somehow helps build them to just be more resilient in the way they approach a certain thing. And it could be built into their work culture. It could be from just their culture as a nation or as a tribe or whatever. And a lot of people just they have, and creative ideas. Yeah, there are people. I remember one of our TRC members had come up with this thing. Just this thing we would do this team where he would have regular energy checks. They would just sort of come together and just have these checks on okay, how are we all feeling right now? Is someone feeling low on energy? How can we support you? And that's just beautiful, just to be able to have that space to be able to share these things. And I'm sure there's a team somewhere else that could sort of benefit from just knowing that and hearing that story. So yeah, definitely. And I think it'd be great if we can continue to build that space where we can share these these creative ways of just starting where we are right now. And as the healthcare community sort of listens to this, why don't you share with us, if has there been something that that helped you sort of while you were on the front lines, while you were working in these more under-resourced settings? What got you? What kept bringing you back to work? What are the things that supported you through that time when you were maybe overworked, underpaid, whatever it was? So share with us what was your experience like? Was there something that maybe someone who's watching this could have picked up and it might help them? So yeah, share with us.
Yeah, exactly. As you said, like those small things like we can learn, right? And those there are creative ways that we maybe we don't think of, but has been implemented somewhere somehow by a certain community of healthcare workers, just like us. And
Yeah,
that could be easily implemented, such as energy checks. But
yeah.
personally, what I found really motivating just to show up and
Mhm.
adds on my resiliency as a healthcare worker when I was working in rural settings, actually the community that I felt, like I felt so loved by my community of healthcare workers in primary healthcare centers that I work. And that's just amazing. Like I miss them so much. Like I work
Oh,
in so I just want to say like thank you for them as well for just being themselves and just always like asking me as well and being also so understanding um all the time, and then also I just don't feel alone when I was working in a
oh,
rural
that's
primary
amazing.
health care center. So I just want to say to them, thank you so much. Or I
Mm.
work in Bali, we said it matur suksma, which is like a
Mm.
thank you. And
Mhm.
to them, because like I show up with them and see them, it's just like oh my God, what's new and what I need to do. So I think those are the things like I think we identify, right? Peer-to-peer support is actually
Right.
one that
Right. Yeah.
makes us show up and the sense
Mhm.
of community um,
Mhm.
of that. And I think it also needs to go beyond that about we talk about a bit, we touch upon the psychological first mental health aid training that
Yeah.
I think we did a bit of the preliminary validations about that for that. And I think those gain tractions. I think a lot of people would love to see that um, in their teams and in their institutions level. I think that's quite important. I think I would love to see how that change would be implemented as well. Those
Yeah.
activities could be done. Um, we see a lot of people see that as a positive thing, but
Mhm.
personally, I think that as a team level, in a team level and individual level, I think there are small things that we can learn from each other. I think we need to continuously advocate for change and
Yeah.
systematic level change in a
Right.
institution and also system level.
Right. Right. Thank you. Yeah, that's so true. And be great if we could just have the a safe space where we could share that with each other and just and it's so crucial to have your community back you up, like you say. And I've seen how that is such a strong motivator for so many people, just to so many of the community health workers to just know that that they are supported and they're backed up by their community, and that makes so much of a difference for them. So yeah, thank you for sharing that, Kevin. Just wanted to ask you past this, what in your time in working with the TRC and just sort of looking through the various models and the and just the multifaceted sort of work towards this. What would you say are advantages that we have in sort of trying to further this conversation to in terms of advocacy, in terms of but also in terms of bringing real tangible change into the systems, but and also share with us some of the challenges that you think we and be great for the community sort of chime in on this, I feel. So and I'm sure that just within the community that there's a every chance of a creative solution as well. So yeah, share your thoughts with us.
I think it's it's the TRC's network. I think that would be like one of the strength, like the main strength that we can leverage to see those impactful changes in local level. And one of the things that I think we discuss about the pathways and the strategic roadmaps that we can implement is also creating those, building on those networks, creating those nodes of change that keeps
Mhm.
spreading
Yeah, yeah.
outwards. And that would influence more and more people, and that will become the norm. I think, hopefully. I think that looks very ambitious, probably, or
Mhm.
looks too, but I think we need to look, take a step back and look that actually just a small day-to-day task that we need to do that will
Mhm.
create those change. It's not something
Yeah.
that we ask. I believe that it's not something that is too big to ask.
Mhm.
Because if we are just creating those small networks and then we connect with other networks and we can keep connecting those networks, it
Right,
becomes, like
right.
our brain, right? It will become like so simultaneous, so seamless, so
Mhm.
easy, and that becomes a norm that builds a habit, right? Just like our brain. Um,
Mhm.
those nodes will create those change eventually. And I think building from those strengths, we can leverage this as an opportunity for us to implement
Yeah.
those change and go beyond the theory.
Yeah, yeah. Thank you for sharing that. That definitely is. Yeah, it's a huge advantage, and we just hope that we can keep building this network and building this community, and have it be active and engaging, and to just keep conversations going as well. So yeah, that's our heart as well. So thanks so much, Kevin, for sharing on your experiences with us. But just as we wind up, we would like to hear a bit more about your work and what it is that you do, what it is you're passionate about. You've mentioned that you've been working on health policy, infectious diseases, and vaccinations, and so on. So, what is it that you are currently doing, and what do you see for yourself in the future as well? And please share that with us. And if there are people in the community who can plug in into that and be supportive of you, that'd be amazing. So, we'd love to hear from you on those.
Yes, thank you. Thank you, Nikita. So yeah, like I'm just fresh off the boat, fresh off the academic boat. Um, Finishing the global health management degree, which we just finished, and I'm so grateful that had the opportunity to learn a lot of different things, like which is goes beyond health policy. I think which is quite unique at Imperial. We just don't talk about just health management or health policies. We learn about economics. We learn about how we can design things with behavioral science lens as well, right?
Yeah, yeah.
And we do how also developing business strategy, doing innovation and change management, how we are doing that, learning about digital health. So it's a very robust thing. So I'm excited for the things to come as well. And I've
Mhm.
been working on, and I aspire to work on things such as um, back into my roots that impacts also um, my community as well. I think it's about
Right.
know, it's health consulting or global health consulting that influence health policy for better equity, that reduce disease burden, that also have, a sense of fulfillment. That's I'm basically
Hmm.
trying to do. And my field of
Yeah.
interest is infectious disease. I love that field that works with immunology as well. So that's how vaccinations kind of like comes in because I
Yeah.
love I aspire to work in that as well. I love
Hmm.
working towards health equity, how we can advance and bridge the gaps that we have and
Yeah.
leverage the things and knowledge that we have by building data, building evidence-based level. And I think now, like, I want to keep continuing working on that, creating those small
Right.
changes and small ripples, because small ripples will turn into big waves
Oh,
eventually. And
yeah.
that's what I aspire to do. And I would love to see that, and hopefully to keep connect with the TRC network and community, to how can we can learn from each other, how can we build upon each other's successes, and um, basically change the norm and further out these conversations and become the common practice, and not just the theory, right?
Yeah. Yeah. All right, that's beautiful, wonderful dreams that we're seeing, and it's amazing that you're taking what you've learned in over these few years and bringing it back to your context and seeing how that can just sort of benefit and help that grow. It's great to see that kind of work, and we're so excited for this generation of healthcare workers and how they're sort of pouring back into their roots and their settings, and it's amazing. Thank you so much, Kevin, for that.
Yeah.
So going forward, we really hope that TRC is able to plug into what you are doing and vice versa, and where that it can be a mutually beneficial collaboration for both of us. And very grateful that you made the time and
Yes.
shared your thoughts and ideas with us. And yeah, we look forward to more from you, and hopefully the community watching this will also enjoy watching you grow within your own context as well. So thank you so much, Kevin, and it's been a pleasure.
Can I
We will continue
close
to.
in one thing that
Yes,
I
of
think
course.
could be useful for our community is
Yeah.
basically we have to remember that we have this powers in numbers, and we have the power
Yeah.
to change and outdate those practices by being
Right.
and keeping our optimism and keep being optimistic, and drive those change. And I think we have to be remembered that sometimes when we are just doing day-to-day basis, we forgot about that. But when
Right.
we, remember that, it makes us like, actually, yeah, we can do things. There are people somewhere around the world in this community that can implement those changes, and I would like to do that. So yeah, I'm so glad of this opportunity to learn more, to work more, and to engage as well. So yeah, I'm very grateful and yeah, like just excited to see what's to come.
Awesome. And what a brilliant note to end this on. Yeah, and change is not impossible.
Um,
It's possible and within our reach. And just so excited to have you here and to have that move forward through the TRC community as well. Thanks again, Kevin, and signing off. Bye bye.
Thank you. Bye bye.